to Pharmacy Procedures 2, Week 4. This week we are going to be covering Chapters 15 and 16. Chapters 15 and 16 deal with different ways to calculate dosages for both adult and pediatric patients. And the first chapter is going to be all about calculating the dose based on body weight. And the second chapter that you're going to cover this week is all about calculating the dose based on what we call BSA. BSA is body surface area. So these are two of the more common ways to calculate dosages. There are other ways to calculate pediatric doses. You will see some formulas out there. There's Clark's rule, Young's rule. Those are some rules that we used to use. They're just formulas, but they're not really used a whole lot anymore. Most docs are going to use body weight. And then if they can, BSA is another alternative. But body weight is probably going to be the most common way that we're going to calculate a dose for a patient. So when we talk about body weight, we're really usually going to be using the metric weight. So we're going to look at kilograms rather than pounds. So it's really important that whenever we are calculating that we check this to make sure that it's actually safe for our patient. So even though the doctor might write something on a prescription, it's always up to us to double check that. So when we talk about whether or not it's safe, we're going to be using kilograms for pediatrics and sometimes pounds or kilograms for adults. Now the easiest way to convert pounds to kilograms is to divide by 2.2. So if you have a patient's weight in pounds, you just divide it by 2.2. So knowing that, you should always keep in mind that the weight in kilograms is always going to be smaller than the weight in pounds. If it's not, that's a good indication that you may have made some sort of an error, so you want to go back and check that. So keep that in mind. When we are converting pounds to kilograms and then using that information to calculate a dose, we typically want to go to the label on the actual medication. On the actual medication, it's going to tell us everything that we need to know for calculating a dose for that particular drug. If it's not on the label, if the package is too small, it will be on the package insert. So those are the places that we're going to go to calculate that information. So the first thing we want to make sure we do when we get ready to calculate a dose is to read. Read very carefully. And then we're going to look at what the safe dosage ranges are for that particular drug. And that's typically on either the label or the package insert as well. And once we know that, we need to make sure we pay attention to, is it a daily dose or is it per a single dose, like per so many doses a day. So we want to look and see what that range is referring to. If it says, 100 milligrams per day, or does it say 100 milligrams per dose 4 times a day, something like that. So you want to make sure you're reading that carefully. And then you're going to actually use that information to do the calculation. So here's an example for us to kind of walk through. Keep in mind that a lot of times, there's a high and a low for the range. So a lot of times we'll calculate both to make sure that whatever the doctor ordered is in between there. So here's the prescription. It's for 125 milligrams of medication every 8 hours. The child weighs 18.2 kilograms, and the safe recommended range for medication is 20 to 40 milligrams per kilogram per day. And what we want to determine is what the doctor ordered safe? So is this 125 milligrams the appropriate amount for this patient who weighs 18.2 kilograms? So what we're going to do is we're going to actually do 2 calculations. We're going to calculate the amount for that patient based on the low, which is 20. So 18.2 is their weight times 20 milligrams is going to be 364 milligrams per day. And then since that was for a day, and we want to give it 3 times a day, every 8 hours, we're going to divide that by 3. So the bottom of the dose range would be 121 milligrams. Then we're going to do the same thing with the top range, which is 40 milligrams. 18.2 times 40 gives us the top, 728 milligrams per day. Since we're giving it every 8 hours, we're dividing it by 3. So that means 243 milligrams per dose would be the maximum amount this patient could have. So what we're saying is that based on this patient's weight, they could get anywhere from 121 milligrams to 243 milligrams per dose. The doctor ordered 125, so it does fall within that range. So that means that we are good to go. So since the prescription is within that range, we know that we're good with this particular medication. So that's a little bit about calculating based on weight. The next chapter is all about calculating based on body surface area. Body surface area is calculated using meters squared, and it's a combination of both weight and height. And there's an actual formula for that. So the formulas are in your textbook, but here they are right here. So here's the 2 different ways you can calculate, depending on whether or not you're using the weight in kilograms and the height in centimeters, or the weight in pounds and the height in inches. So these are the 2 different formulas to calculate BSA. And then once you know what the patient's BSA is, you will use that to calculate the dose based on whatever the label says. So you'll again go back and look at the dosage range and see what it says, and then you'll just multiply that times this BSA that you calculated. So if you have any questions as you go through this week's material, please make sure you reach out to me, and have a great week.